Now, government has finally given the green light for the operationalization of the University of Ghana Medical Center following a huge public outcry over the abandonment of the facility. The opening of the facility is expected to ease pressure on the existing hospitals like Korle Bu, where health officials have been under pressure and forced to treat patients on the floor and in chairs due to the limited number of beds. With the opening of the facility, what is likely to change? Before we bring you a conversation on that topic, here's a bit of a background into the University of Ghana Medical Center. So it started in April 2013 as it started on 2013 at a 10-key project. Phase 1 of the project was completed in July 2017 and inaugurated by former President John Mahama. The cost of facility is $217 million and it has a 650-bed capacity. Now, the facilities include an ultra-modern medical gadgets for treating complicated medical conditions and a helipad to airlift emergency cases, as well as a medical hotel. The facility was scheduled to open in November 2017, but was kept locked due to a tussle between the Minister of Health and the University of Ghana over who manages the facility. Now, pressure started mounting on the government to operationalize the center, and Ghanaians signed on an online petition as part of a social media campaign to push the government to operationalize the 650-bed capacity medical center. Government announced the opening of the facility after persistent outrage over the abandonment of the $217 million facility. Operationalization of the facility begins on July 18, 2018. Walk-in patients will not be attended to, strictly outpatient departments, only referral cases, and limited specialist services to 3 main departments. And as you may be aware, the facility is scheduled to open on July 18. Now, the facility will start off with about 30 to 40 staff approved by the Ministry of Health. Government says it will need at least 2 weeks to begin recruitment of staff to other unused facilities, after which they will be made operational. Now, the Finance Ministry has already given approval for the recruitment of 800 staff to manage this facility, and we are looking forward to this July 18 inauguration of the facility. Now, Cabinet has already approved a $50 million for the second phase of the center. Part of the $50 million is expected to be used to procure drugs and non-drug consumables, as well as secure reliable power supply for the hospital. Been trying to get the Deputy General Secretary of the Ghana Medical Association, Titus Bayo, to react to this. I'm sure this will come as good news to the association. When we get him, we will ignite that conversation of how this long-awaited inauguration of this health facility will help ease congestion. We are aware that in the past days we've seen Korle Bu Teaching Hospital treating patients on the floor in plastic chairs, and they explain that the hospital is overwhelmed. We've also heard the Minister of Health saying that when you have headache and stomach upset, don't go to Korle Bu, go to other smaller clinics and hospitals. But we're looking forward to having a huge relief in the health sector with this facility commissioned in July 18.